Today I'm going to show you a quick fix mobilization for generalized knee pain. What's going on, everybody? It's Blake Bowman here at Gorilla Zen Fitness, and today I'm wondering how many of you have knee pain. Obviously, knee pain can be caused by a lot of different things. Okay? A lot of different factors can cause knee pain. But today what I want to show you is a quick fix mobilization that you can do using a softball. But before moving forward, just realize that this is just a quick fix, okay? You always want to address the root of the pain and dysfunction first before you attempt to do things like this. This is more useful for if you can't discern what is causing the pain at the root level, or if you're in the process of discerning, like if you're getting assessments by somebody like me or a physical therapist, and you're kind of in the process of uncovering movement patterns and muscle imbalances that might be causing the knee pain. This technique will provide, however, almost immediate relief for a variety of different causes of knee pain. What this technique is it's called flexion gapping, okay? And I learned about this in Dr. Kelly Starrett's book, Becoming a Supple Leopard. Basically, what we're going to be doing is we're going to essentially be taking a lacrosse ball, putting it under the knee, and then pulling on the shin bone to compress the ball with the tissues of the calf and the lower hamstrings. And what this is going to do is a couple things, okay? The biggest thing that it's going to do is it's going to release all of those attachments around the knee, okay? The calf attachments and the attachments of the hamstring, which cross over the knee joint. Both of them do, the calves and the hamstrings. If you get really, really tight in the hamstrings and the calves, which cross over the knee joint, the attachment points can basically start tugging at the attachment sites, okay? And that can cause like localized inflammation that can cause pain. So basically one thing that this is going to do is it's going to release those attachment points, okay? The soft tissues around the knee. The second thing that this is going to do is it's literally going to produce a gapping force, okay? So, and what that means is it's going to actually make more space in the hinge, which is your knee joint, okay? So your knee joint is like this, right? It's a hinge, just like a door hinge. Basically, we're going to put the ball right here so that when you hinge over it, it's going to gap the joint like this and give you a little bit more room to move around, basically. So people that have like degenerated cartilage in their knee and they're getting that bone-on-bone grinding, this is a nice way just to gap that joint, create a little bit of space between the femur and the bones beneath it so that you don't have as much grinding going on. Keep in mind though, like I've said already, this is just a quick fix. Again, like I said, this is only a quick fix. I really want to reiterate that. You really still want to go through a movement screen, do your best to identify your muscle imbalances and the movement patterns that you have, and try to address it on that level rather than just doing this. This will help get you there though. Alright, like I said, all you need is a lacrosse ball. And basically what we're going to do, as I described, is we're going to put it underneath the knee, okay, just like this. You're going to then lace your fingers around your shin bone and pull the shin bone towards the butt. Okay, you're pulling the heel towards the butt, compressing that ball, okay? And from here, this is a crucial part. You want to actively roll around the ankle, okay? We're trying to get some calf activation here, a little bit of active release. You're just going to continue to do this with the ankle the entire time while you're doing this mobilization, okay? But you want to hit all of the, I'm right in the center right now. You want to move off to the side, like over here a little bit more while you do this. Pull that thing, compress it hard, roll that foot around in all directions. You want to come to the middle like I started, okay? And then you also want to come to the inside right here, okay? You're basically just trying to get all of the spots underneath here. You're trying to hit all of those attachments, okay? And while you're doing this, this can feel, especially if you have knee pain and it's caused by these attachments around the knee, this is gonna really hurt really bad. It's gonna be horrible feeling, especially where the ball is in contact with the attachment point, so under here. If you're feeling pain up here, higher in the knee itself, when you're doing this, then I would recommend really being gentle with this. Do not pull very hard. However, if you're just feeling like kind of general discomfort down here, right where the ball is actually in contact with the hamstrings and the calves, then I would say it's okay to just keep pulling, keep moving around that foot okay, because you're releasing those attachments. But yeah, like I said, if you're feeling pain up here in the knee as a result of this gapping force that we're creating, then I would recommend laying off of this and maybe even not even doing this exercise. But for the majority of people that have like just attachment tightness in their calves and their hamstrings, you're going to get enormous benefit out of doing this exercise. You should really spend about like 3 to 5 minutes doing this on each knee, and I think you're really going to be like impressed with the way that this makes your knee feel afterwards. I really hope this helped you out and you enjoyed this video. If you did and you're not yet subscribed to my channel, go ahead and do that right over here. Also, make sure to check out my Facebook page and like it, and also check out my Instagram and follow me there. I'll include links to both of those things in the description down below. Lastly, make sure to pick up my copy of my new ebook, Posture: The Ultimate Life Hack. It's all about posture, corrective exercises, and common postural distortions and the fixes to them. So it's basically a lot of the things I talk about on my channel here, all about posture, all consolidated into one PDF ebook. Also, if you want me to be your coach, if you want me to analyze your posture for you, help you discern what muscle imbalances you have, analyze your movement patterns and things like that, basically help come up with a corrective exercise protocol specific to you and the imbalances that you have going on, then go ahead and open up the description down below and hit coaching. Other than that, as always, I'll see you next time.